gonna start our session in 3 minutes. Hope everybody have watched the week 2 videos. Today we will be discussing more of the contents from uh, second week's videos. And in second week's videos, the course covers a lot about the basic terminology mainly. So these basic terminologies will be needed to solve the questions, problems, and also in real life, these terminologies will help in case when we are going to a hospital, and most of the time uh, we will be or you or some of your relatives will be having a imaging or any procedure. The reports will be having all these terminologies. So in that aspect, these biomechanics terminologies mostly are from anatomical. So these has a major overlap with the anatomical nutritions also. So these basic terminologies will help you in understanding those medical reports also. So these basic terminologies in biomechanics is not just for the course; it will help in our actual life also. So better uh, if you understand these terminologies, then it will be easy to read and understand any of the medical reports, or even if we have not just imaging, when we undergo any medical procedure or something, there will be an end report. To understand the end report, these kind of terminologies will help, because most of the doctors and the medical reports will have all these anatomical and biomechanics kind of terms. So with that understanding, it will be easy to understand what has been done, or what is the clinician or the doctor is referring. And then there's end of this week 2 videos. There's 2 videos on the skeletal muscles. So these skeletal muscles are the motors or the powerhouses which are kind of helping to move our limbs or body parts. So how these skeletal muscles are moving that, or forces, how the force is being developed, that's also been discussed in week 2 in excitation coupling a manner. And mostly the video is, I mean, this week 2 is comprised of basic terminologies and how we can refer the motion, or how we can, in biomechanics terms, how we can represent or say or express the motions and uh, movements. So moving on, we can have a short recap. I think most of the people have joined. Let's see, anybody left? Okay. So in let's have a short summary of week 2 videos. In starting with uh, what is biomechanics, that has been discussed, and how in our last interaction itself, I have just mentioned about what is mechanics and how it is being divided. So that's also been discussed here. That is the different study branches of mechanics, and in which branch the biomechanics is coming under, and also the anatomical reference position. So to say anything, we need some reference frame. So that is kind of from mechanics. The basics of mechanics is uh, constituted or comprised of a world frame or something universal. So some universal should be mentioned to describe motion uh, or relation. So that kind of in if we have a Cartesian coordinates, we have studied in school level. So we have x and y plane, 2x to positive x. So we have a zero origin point. So this origin point is kind of a reference point like that. So anything in this 2D plane can be in relation to this origin and this axis. So that is something reference. So this is kind of simply saying this is a Cartesian coordinate system. Cartesian coordinate system, and here references are the reference point is origin point, and reference axis are x and y axis. So any point or any line or any geometry, any shape in this plane can be, we can fix the position with the using these axes and points. So this is kind of a reference. So similarly, mechanics use these kind of references. We need frames. So because why I'm saying this is like when we are going to the fourth or fifth weeks, there will be multiple frames of reference when we are discussing about Dynavit-Hartenberg equations and DH equations. There will be multiple frames of equation, and we have to convert from one frame to another. So this is kind of one frame. So simply, I am suppose I am discussing in 2D is kind of one frame. So in suppose we want to convert this to 3D, we have to only have to add one more axis like Z axis. So this is one frame of reference, and we can fix one reference axis. Uh, suppose we are simply thinking of a human arm, then suppose we can take the shoulder joint as a universal reference point, and all other okay, and all other uh, limbs or bones or muscles can be fixed with local frames. So there should be one universal frame, and with respect to that, we can create multiple local frames also. So actually, not just frame; it's called frames of reference (FOR). So similarly like that, here we need an anatomical reference position. So with that only, because we have to first fix what is our reference. So such a reference position of human body is called anatomical reference position. And then there is discussion about key terminologies, which are the basics terms and axis planes and the terms included in explaining the anatomical position, and which are the motion with respect to these planes and bodies. And also, we have seen what's the difference between biomechanics and kinesiology. Biomechanics is the study of structure and function of biological systems using tools of mechanics, whereas kinesiology is the study of human movement, and anatomy is the study of human body structure. So this is the difference between biomechanics, kinesiology, and anatomy. So this is the anatomical reference position. So here, if you see, you can see that the body is in an erect position. Hips and knees are extended. That is, it is fully extended. hip also it is not bending. It's not, the position is not bending forward or leaning forward, and also knees are fully stretched outside, stretched straight, and face looking forward, eyes open and looking forward, mouth closed, arms down at side. So arms is just kept down, and palms facing to the front, keeping and the feet to foot are parallel and together. So this is the anatomical position, anatomical reference position, and we will be using this reference. We will be saying any movements with reference to this anatomical reference position. And this is the directional terminology. Once we have fixed our reference position, then we can easily define the directions. So it's like when we have this origin, 0, 0 origin, and x-axis and y-axis, we can say some line is parallel to x-axis, or some line is parallel to y-axis, or how much away from the origin point. All those things can be fixed or expressed only we have a reference position. So with that, we can use this reference position to fix our directional terminology. And these terms, if you have ever seen any X-ray report, CT and CT report, or any medical reports, you might have seen at least one of these terms in that. So let's see what are this. One is like superior. If it's in the top side, it's called superior side, or upward direction is called as superior side, and towards downward is called inferior, or bottom of the body. Posterior is towards back of the body, anterior is towards front of the body. And also similarly, this superior and inferior has two other names like cephalic and caudal. Cephalic is towards the head, caudal is like cord is another term for tail, so it's like towards the tail bone. So cephalic and caudal is two other words, which is saying closer to the head and closer to the tail. And posterior, proximal and distal is on the two terminologies. Like proximal is towards the center of the body. It is suppose we are fixing some center of the body as here. So anything towards the center of the body is called proximal. Anything going away from the center of the body is called distal. So in, if you are taking hand, then this is the our fingers or digits will be towards the distal point, whereas the shoulder and biceps will be in the proximal end. Similarly, in foot, leg, the foot will be in the distal position, thighs will be in the proximal position. And lateral and medial. Lateral is kind of moving away from the midline of the body. Suppose if we are taking this as the midline, we can cut the body into half, symmetric halves by such a line. So that is a midline. So anything moving away from the midline is called lateral, and anything moving towards the midline of the body is called medial. And another two terms kind of confusing with terminology is called, with the superior is called superficial. Suppose I am taking some cross section here of cross section of hand here. So it will be look like something like this. So there will be centrally there will be the bone, humerus bone will be there. Then muscles will be there. Then the skin will be there. So when we have some cross section kind of thing, then this term comes, or peripheral. the meaning is just peripheral. So when in questions there will be some superfluous data saying that superficial or something. So it is only to confuse you with the word superior. So one word that can confuse you with superior is superficial. Superficial is nothing like the periphery, the skin kind of thing. We have a cross section or section of a body or outer body or outer the outer layer. That's what's mean by superficial. And deep is something going inside this cross section. So this bone is, for example, it is kind of deep. It is seated deeply. So in medical reports, will be saying like some tumor is seated deeply in this position. So that deep is saying going inside the body, and this will be this position. Something between superficial and deep is called intermediate. So this So these are three times: superficial, intermediate, and deep are coming in the picture when there's we have a section of body. We are kind of sectioning or we are kind of looking inside the body. Then another concept is laterality. So when we are saying about only one side of the body, then it's called unilateral. So uh, when we are when the doctors or physiotherapists will be talking about one particular limb or one side of the body, they will be using the term unilateral. Whereas uh, suppose one condition is affecting both the limbs or both sides of the body, then it will be called bilateral. And ipsilateral is the term saying, like suppose here bilateral is like mostly bilateral will be using for two legs. It's like affecting the legs bilaterally, affecting the upper limbs bilaterally. Like that, the terminology will be. Whereas ipsilateral is saying on the same side. Suppose we are referring to two organs that is not directly in contact, but on the same side of the body. So such uh, situations, the terms mostly will be used as ipsilateral. Not on, we won't be saying the right or left because right and left can be confusing. So mostly the term, the report or the thing will fix one reference point, that is right hand or right leg, right lung. Some reference point will be saying. Then going forward the report or continuing the discussion, it will be saying as ipsilaterally this is happening. So that's one uh, word specifying side of the. So it's like in relation to the affected part. Similarly, contralateral. Contra is kind of the word for opposite. So it's like if some condition is affecting contralaterally. So in there is something like the brain controlling of the brain. So it's like brain controls the body contralaterally. That uh, concept is there. So in such conditions and other, when we have to say or relate one limb to the opposites different limb kind of situation, the word contralateral comes into picture. Then anatomical planes. So these planes and these words, uh, anybody who has seen a CT image, CT scan report or image, or even X-rays would have seen this sagittal, coronal, or transverse. Or even when the doctor asks you for to do some scans or X-rays or something, they will be write which view they want. So in that particular uh, report or particular prescription itself will be saying which view they want. So these are three views: sagittal, coronal, transverse. So sagittal is, if you for easy remembering these things, we can uh, use these kind of mnemonics. Like S is for sideways. So the plane which can move sideways. Side is like right side and left side. So something that can move from left to right is called sagittal. So if you can see this plane is kind of fixed medially or through the midline of the body, or it is one of the sagittal planes, and we can create numerous sagittal planes from uh, this end of the body to the other end of the body, or right end of the body to the left end of the body. So the which the plane which can move from side to side is called sagittal plane. And next is coronal plane or frontal plane. So corona is related with eye. So the plane which is in the direction of uh, viewing is, or what placement of eye is called coronal plane. In that way you can remember it. So this plane can move from anterior posterior direction, AP direction, front to back. That's why it's called frontal plane also. Then next one is horizontal plane or transverse plane, where it will be, the body will be cut into uh, the cross section of the body can be created. That is the transverse plane. Then these, if we are constructing these planes, I am taking, if suppose I am taking one particular sagittal plane through the midline of the body, another coronal plane through the center of the body, and again the third transverse plane at the center of the body, then this will intersect to create three axes. So the plane where uh, sagittal plane and coronal plane uh, meets is known as craniocaudal line, craniocaudal axis. So the from the word itself, it is intuitive, because cranio means something related to skull, and caudal is something related to tail. So some one line or axis connecting skull and tail is the craniocaudal axis. And the axis, or the line where transverse plane and coronal plane meets, is called left right axis. So the axis that is traveling from left to right. Similarly, the axis which is created by sagittal plane or medial plane and a transverse plane is called dorsoventral plane. Sorry, dorsoventral axis or anterior posterior axis. This uh, axis is the reference for, to say, superior inferior side, so the upper section, lower section, or simply superior and inferior is uh, the words are used to say in relation. We can say just head is superior, place is superior to heart. So it's like head is coming above, or the skull is coming above, or something. So one particular rib is superior to this particular rib. That way we can say the position which is coming upwards or downwards. Next is skeletal muscle. So in between I have skipped some portions. I hope you have watched the videos. I'm not stretching the summary section too much, and we'll be moving towards our questions. So this is a section of skeletal muscles. Here you can see the bone and the muscles, and the muscle which is kind of connected to the bone using a tendon, and how the muscle fibers are uh, created and constructed. So there are muscle fibers, and there are bundles of muscle fibers which is covered by a fascicle. Then perimysium is there, endomysium and epimysium. These are kind of coverings for this muscle, and you can see how what is the shape of the muscle also. So So let's move on to questions. Uh, Please keep the session interactive. You can inbox the answers. I will give the question. I will read out the answer and give some time. Try to answer the question. Uh, don't worry if the question is wrong. You can make all the mistakes here. Only objective is to get the answers right in the exam. So because there will be some confusing questions to test the presence of mind. Most of the times NPTEL questions will be simple, but the thing is like they can test your presence of mind. So first question, which of the following is a two degree of joint, two degree of freedom joint? DOF is for degree of freedom. How most of you might have heard this word, a degree of freedom. So degree of freedom simply means the allowed motions or the number of motions allowed in for a particular joint is degree of freedom. So the question is, which of the following is a two degree of freedom joint? So which of the joint has 2 degrees of freedom? Options are option A, first option, shoulder joint. Option B, Atlanto-occipital joint. Option Third option, Atlanto-axial joint. Last option, hip joint. So it's like when we have more than one, so I'm sorry, when we have which of the following joints have 2 degrees of freedom? So, in last session, we have discussed what are the kind of synovial joints in our body. We have discussed about six types of joint. So, if you remember which kind of joint they are, shoulder joint, what kind of joint is shoulder joint, then it will be easy to say what is the number of degrees of freedom present there. Try to answer the question. So, so shoulder joint we have discussed. It's a ball and socket joint. Uh, this Atlanto, the word Atlanto uh, comes to the neck bone joints. Hip joint, you can understand from the word itself. It's in the hip joint, and uh, yeah, I can see there's confusion in Atlanto joints. Actually, Atlanto occipital joint is the suppose, yeah, it's a symbol diagram. So suppose this is the final bone, that is a C1 joining the cranium. zeroth portion. So that 0 C1 joint is called as Atlanto-occipital joint, and C1 C2, that is below the C1 is C2. So C1 C2 joint is Atlanto-axial joint. Actually, Atlanto-axial joint has more number of freedom. The only the Atlanto-occipital joint, that is AOC joint, has 2 degrees of freedom. So this is our answer, Atlanto-occipital joint, because the top portion uh, only has uh, sideways rotation and uh, flexion and extension in two planes. It only has the moments, but whereas the C1 C2 and other following joint has more number of freedom, that is the Atlanto-axial joints. So next question is purely mechanics, based on mechanics. In a FBD, that is free body diagram, which of the following should be included? This also we have discussed in last class, what is a free body diagram and all. So if you can recollect it, try to answer the question. Or even if you have done a basic mechanics course, you will be knowing what's a free body diagram. So the question is, in a free body diagram, which of the following should be included? Options are all external forces acting on the object. Option B, object's internal structure. Option C, object's dimensions. Option D, reaction forces at supports or contact points. Try to answer the question. What all will be there in a free body diagram? All external forces acting on the object's internal structure, object's dimension, reaction forces at supports or contact points. So simply imagine, suppose there is a log of wood resting on two stones, which is being hit by a hammer or something. So how can you represent this image? These are the supports. This is the log of wood, and this is the force of action acting, the direction of force acting on it. So how you can represent this figure using a free body diagram? Then you can easily pick up the solution from the top choices. Okay, so this particular thing, if I am converting to a free body diagram, then this log of wood, I can simply convert into a line. Simple line I can convert, and the I only need to address the position. So suppose these two ends are A and B. So what's the distance from A or B that the force F is acting, and also where the supports are being given. So this is a simple free body diagram for this particular scenario. Here you can see I have only taken the external force acting and also the reaction forces at the support or the contact points. I don't have I don't want to have any idea of the object's internal structure because I don't want to know whether the log of wood is hollow or it is kind of having any other particular structure, and also the object's dimension. That is, what is the cross section of this particular wood, log of wood, whether it is circular, square, or rectangle. I don't want to know. But for because we are only uh, analyzing the forces in equilibrium. That is, we are taking it as a equilibrium condition and it's a statics problem. So for that, we only need to understand the relative position of the forces acting on it. So there are two kinds of forces, which is first one is external force acting on it and the reaction forces acting against it. So this AB line is only to represent, only to give the idea how these particular forces are related to each other, or where is the relative positions of these forces. So first option and last option are right. So I have mentioned in the last session also, in NPTEL exams, there will be multiple answers will be there for a particular question. There won't be any mentioning of that in the question. So always, if you feel more than one answer is correct, try to click on the other option. If that particular question is taking multiple answers, then you can choose multiple options. If it is not accepting multiple answers, you can't click on the next question, next option. So whenever you are in doubt, try to click the other box also. So if it is getting selected, then you can easily understand it's a multiple choice question. Sorry, multiple answer question. Moving to next question. And also keep in mind that the multiple answers will be there for assignment questions also. You have weekly assignments for NPTEL courses. So in that weekly assignments also, there will be cases where there will be questions having multiple answers. So try to click on that. I think in NPTEL website, you can easily figure out by seeing that if whether it is for assignments, you can see that if the clicking portion is in square, it is having it is accepting multiple answers. If it is circular, that uh, clicking portion, the clicking button is in circular, then it is having only one answer. That is kind of a crude methodology, but I will prefer to try clicking on more than one choices to make sure. Next question. In anatomical terms, superior is synonymous with which of the following description? So here the question is about the terminology superior. So in anatomical terms, superior is synonymous with which of the following descriptions? First one, closer to the top of the head. Next one, closer to the feet, closer to the front of the body, closer to the back of the body. So in anatomical terms, what does the word superior mean? You can inbox your answers. The answer is option 1, that is closer to the top of the head. Next question. Which of the following movements occur in sagittal plane? Options are flexion and extension of elbow, abduction and adduction of arms, medial rotation of thigh, lateral flexion of the spine. So which of the following movements occur in the sagittal plane or with reference to the sagittal plane? Is it flexion and extension of elbow, abduction and adduction of the arms, medial rotation of thigh, lateral flexion of spine? You can inbox your answers. Okay. Some of you have, I think some of you have answered like option B. Okay. So here the right answer is option A, that is which is the flexion and extension of elbow. So let me go back to the figures. So if you see here, this is the sagittal plane. The first one is the sagittal plane. So the extension, flexion and extension of elbow is this one, the movement between the forearm and biceps, that upper arm portion. So this is happening in a sagittal plane. If I have the suppose the hand is particularly dropping downwards, then and if you assume the bone is in lying in this particular plane, there is actually there is one slight tilt is there, but mostly this rotation is happening in this plane. If you are looking from this side, I mean from lateral side, you can see that is orthographic to the sagittal plane. This motion can be fully seen. So the flexion and extension is happening in sagittal plane, whereas abduction and adduction of arms, it is going taking arms. Abduction is kind of moving arms away from the body, and adduction is keep coming closer to the body. That is happening coronal plane. So it is not happening in sagittal plane, but it is happening coronal or frontal planes, whereas flexion and extension is happening in sagittal plane. So that clears the confusion. Next one, which one is called the mediolateral axis? The mediolateral axis is an axis that runs from the front of the body to the back, an axis that runs from side to side of the body, an axis that runs from top of the body to the bottom of the body, an axis that is perpendicular to the coronal plane. So which one is called a mediolateral axis? Write in both the answers. Okay, the answer is here. If you see the question, it is saying mediolateral. The terms are mediolateral. So this is connecting two words, that is medial and lateral. So if you remember, like medial, the word medial means suppose this is the midline of the body. These are two hands and two legs. So anything towards the midline or center is called medial, and anything away from the midline is called lateral. So it is connecting towards the center and away from the center in the midline in the side by side manner. So the answer is an axis that runs from side to side of the body. So these directions can be easily expressed using mediolateral axis. Like we say minus x-axis and plus x-axis or x-axis simply. Here the medial axis and mediolateral movements can be easily explained using mediolateral axis. And the axis that runs from top of the body to the bottom is called craniocaudal. That also we have discussed. Cranium is the head, caudal is the tail. Next question. Which of the following is not a function of muscles? Options are kinesthesia, maintenance of posture, production of heat, nutrient absorption in digestive system. Question is, which of the following is not a function of muscles? Options are kinesthesia, maintenance of posture, production of heat, nutrient absorption in the digestive system. You can inbox your answers. So the first word is called kinesthesia. It's kind of sense of uh, body position. So if like uh, even though we don't see where our arm is, but we can still know where our arm or the finger is. So that sense of where each of our body part is or limbs are, in that sense is known as kinesthesia. Maintenance of posture, you know what it is. Production of heat also, you know. Nutrient absorption system. So if sometimes it's like you have in the videos itself, it's like there's an explanation what is there are different types of muscles which are skeletal muscles are there, smooth muscles are there, cardiac muscles are there, and mostly smooth muscles line our GI tract. So, and the question is asking broadly about muscles. So, in that way, if you think there can be a confusion uh, because in digestive system it's also lined with smooth muscles. But the thing is, the often is saying nutrient absorption. Even though the GI tract and stomach digestive system is being lined with smooth muscles, the absorption mechanism is not done by the muscles. So all the three, kinesthesia, maintenance of posture, production of heat. So kinesthesia because the skeletal muscle fibers has nerves. So these nerves give the information about where each of our organ is or each of our limb is. That's why the muscles give information of the position of the body and also maintenance of the posture. That is, our bones mainly gives the proper structure, and the bones are being uh, connected with the muscles. So maintenance of posture are there, and also production of heat. The movements of muscles creates production of heat. So that is visible when you are uh, moving your body. I mean, actively moving the body as if in exercising and all. So the first three options are functions of muscle, whereas nutrient absorption is not. Right answer is last one, nutrient absorption in the digestive system. Next question. This one is from excitation contraction coupling of muscles. What role does troponin play in excitation contraction coupling? Options are it binds calcium, leading to the movement of tropomyosin. It binds actin, forming cross bridges within myosin. Next one, it directly catalyzes the hydrolysis of ATP, adenine triphosphate. Last option, it exposes the binding sites on actin for myosin. So this is kind of little deeper question uh, directly from excitation contraction coupling. So what is the role of troponin in excitation contraction coupling? Try to answer the question. Look again. Those who have answered, look again. Try to check whether the answers are correct. What the role does troponin play in the excitation contraction coupling? The troponin actually binds with calcium, leading to the movement of tropomyosin. So this is the direct function of troponin. When the troponin is released, it binds with the calcium, and which leads to the movement of tropomyosin. But in effect, what is happening? It exposes the binding sites for the actin for myosin. So both first one and last one are the roles of troponin, because this is the direct job it is doing, and this is the result of this function. Troponin binds with calcium, leading to the movement of myosin, tropomyosin, which exposes the myosin sites for actin to bind. So both first and last options are correct here. Binds the calcium, leading to the movement of tropomyosin, and doing that, it exposes the myosin sites for the actin to bind. Next question. Which of the muscle has no striations and is under involuntary control? Options are skeletal muscle, smooth muscle, cardiac muscle. Last option is both B and C, that both smooth and cardiac muscle. Which of the following muscles has no striations and under involuntary control? Yes, answer is option B, smooth muscles. Both skeletal muscle and cardiac muscles have striations. So, the muscle which has no striation and is under involuntary control is the one that is smooth muscle. Next question. Which of the following is basic functional unit of skeletal muscle? Options are sarcomere, myofibril, myosin filament, muscle fiber. Which of the following is the basic functional unit of skeletal muscle? Repeating the question. Which of the following is the basic functional unit of skeletal muscle? Options are sarcomere, myofibril, myosin filament, muscle fiber. Yes, the basic functional unit of a skeletal muscle is called as a sarcomere. Option A. Next question. Which of the following types of contractions are most effective for building muscle mass? I hope this everyone will be knowing. Which of the following types of contractions are most effective for building muscle mass? Options are isometric contractions, option B concentric contractions, option C eccentric contractions, option D all of the above. Only one person has circled. So option C, that is eccentric contractions. Eccentric contraction is simply eccentric means lengthening. Simply remain it as lengthening of the muscle fiber, and it occurs, eccentric contractions occurs when the force or the applied force is greater than the momentary force produced in the muscle. So this eccentric contractions are good for strength gain, not just for muscle building. It is good for strength gain, muscle mass, and also neural activity. So that is like weight training. If you are applying force, that's why the basic idea of gym training or uh, weight training is. So by that, the eccentric contractions will be happening in the muscles, with which the lengthening of the muscles happen. That muscle breaking, new muscle creation, or muscle fiber strengthening process will be happening. By that, all three activities, that is increasing in muscle mass, strength gain, and also increased neural activities, all three will be happening in the muscles. Next question. What is the pennation angle in the muscle fibers? So fancy name, pennation angle. So what is called the pennation angle in the muscle fibers? Options are angle between muscle fiber and the tendon, angle between the adjacent muscle fibers, or is it the angle at which the muscle force is transmitted to the tendon, or the angle at which the muscle contracts? Which among the following is termed as the pennation angle in the muscle fibers? Try to answer the question. Try to answer the question. So most of you have answered like the angle between muscle fibers and tendon. So that is the right answer. But it is also the angle at which the muscle force is transmitted to the tendon. So option C is also the answer. So this question has two answers. That is the angle between muscle fibers and the tendon, and also the angle at which the muscle force is transmitted to the tendon. Next question. What does PCSA, that is the physiological cross-sectional area, represent in a muscle anatomy? Options are the total area of muscle fibers cut perpendicular to the muscle's length, the area of muscle at the point of attachment to the bones. Option Third option, the total area of muscle at the level of its tendons. Fourth option, the area of muscle fibers aligned parallel to the tendon of the muscle. So what does PCSA represent in a muscle anatomy? That's a question. Try to answer the question. So what does PCSA, that is physiological cross-sectional area, represent? So if you remember, there is two different uh, cross-sectional areas. First one is PCSA, next one is ACSA, where A stands for the anatomical. So anatomical cross-sectional area and physiological cross-sectional area. Suppose we have one particular muscle like this one. And this is the midline. The fibers are arranged like this. So this is the muscle fiber arrangement. Then this area that is perpendicular to the muscle length is known as physiological cross-sectional area. That is the one I have drawn here in red. Okay, the one I have drawn here in red is called physiological cross-section area. That is the option, first option. That is the total area of muscle fibers cut perpendicular to the muscle length. Whereas anatomical cross-sectional area is the simply the cross-sectional area of the fiber. Suppose I am taking this cross-sectional area, then this is ACSA and this one is the PCSA. So this is the difference between PCSA and ACSA. Next is total area of muscle fibers cut perpendicular to the muscle's length. Okay, next question. This one is simple one. Biomechanics is best defined as the study of which of the following? Options are biological tissues only, motion without forces, mechanical principles applied to living systems. Next one, exercise physiology. Biomechanics, which is the best definition for biomechanics. Try to answer the question. Simple one, yes. So everybody answered it. Can you right option is option C, mechanical principles applied to living systems. Can you name the other branches of study? What is the study which is studying only biological tissues? We can quickly answer these questions, then we can move on. It's kind of basic questions. What's the branch of study that is studying biological tissues? Okay, the study of biological tissues is known as histology. Whereas the study of motions without forces, this we have discussed in the last session, and also this week two's videos have it. It is called kinematics. Biomechanics, we know it's a study where the mechanical principles applied to the living systems. And exercise physiology itself is a name of study where we are studying the motions, the physiology under exercise conditions. Next question. Which of the following is the key objective of biomechanics? Options are measuring biochemical reactions. Next option, analyzing forces acting on biological systems. Studying cellular genetics. Or third, imaging internal organs. Another simple question. Yes, option B, that is analyzing process acting on biological system. The just previous question was about what is biomechanics, which is applying mechanical principles on biological system. So mechanical principles, using mechanical principles, we can only analyze the forces. We can't measure the biochemical reactions using uh, uh, mechanical principles, and also we can't study cellular genetics or imaging. So only option is option B, analyzing forces acting on biological systems. Next one, the sagittal plane divides the human body into what kind of parts? Superior and inferior parts, anterior and posterior parts, left and right parts, medial and lateral parts. So simple but tricky question. The sagittal plane divides the human body into superior or inferior parts, or it anterior or posterior parts, or left and right parts, or medial and lateral parts. Okay, the option is option C, that is left and right parts. So even though simple this, there will be some confusion between left and right and medial and lateral. So please keep this in mind. The plane divides the human body into. So when this left and right is can be section as termed as left part or right part or section. So if the plane is sectioning the human body, it can split it in the left part or left section. Similarly, right part or right section. But medial and lateral is kind of direction. So we can say how to move the particular plane, or the relative positions can be inferred or expressed using the terms medial and lateral. So medial and lateral, it is not convention to say medial to this particular plane, because for that we can only say if that sagittal plane. I already told you we can have many sagittal planes. So when if only if the sagittal plane is fixed, then only we can say uh, which medial to it or lateral to it. So there is no convention of saying medial part or lateral part. We will be saying left part or right part with the relation to sagittal plane. So I think medial and lateral is kind of used for expressing direction of movement. So by that explanation, you can simply answer this question. The movement occurring in sagittal planes takes place about which axis? Options are longitudinal axis, anterior posterior axis, medial lateral axis, vertical axis. You can quickly answer these questions. Movement occurring in the sagittal plane takes place about which axis? Still confusion. Okay. So suppose this is one particular sagittal plane. It will be difficult. So let's go back. So here the first diagram shows the sagittal plane, and we already have discussed the motions happening in sagittal plane, that is uh, extension and flexion of elbow. So this is one motion happening in sagittal plane. So this particular motion is happening to an axis perpendicular to the plane, that is sagittal plane. So axis that is going perpendicular to the sagittal plane is the axis of reference for this particular motion. Suppose this is the axis and this is the flexion, extension, rotation. So if you can imagine one particular axis going towards the sagittal plane through the elbow, then that is that axis. And this particular axis is traveling from where to where? This is from traveling from left to right of the body, or right to left of the body. Or in terms of direction, it is moving from lateral to medial. That is from outside or away from midline towards midline. So that is mediolateral axis. So any motion that is confined to sagittal plane is happening with respect to, because a motion confined to one particular plane, sorry, a rotation uh, confined to one particular plane will be happening with respect to the axis perpendicular to that plane. So the axis that is perpendicular to sagittal plane is mediolateral axis. So any rotation happening in this plane will be with respect to this particular axis only. So our answer is mediolateral axis. This is our question. Movement occurring in sagittal plane takes place about which axis? That is mediolateral axis. So whenever, uh, because there is nothing about translation in our body in, with respect to its own other part, we can only rotate. So like abduction, adduction, flexion, extension, everything is rotation. So all the rotation needs one particular axis of reference, and this axis of reference will be perpendicular to the plane which the motion is confined to. Next question. Which movement primarily occurs in sagittal plane? So because now you can simply uh, answer this question, because it's like we are continuously answering one particular plane or concept only. So here it will be easy to answer. But in actual exam, when this question is mixed up with all other concepts, this can be confusing. So focus on this word, that is which moment is primarily occurs in sagittal plane. Options are abduction, flexion, rotation, circumduction. Options are abduction, flexion, rotation, circumduction. Yes, that is flexion. So whenever some questions like this are coming, because there will be uh, confusion between the movements, but try to think reverse in opposite fashion. Try to find the examples, or I mean more than one example of motions occurring in sagittal plane. So if you can recollect what is the flexion and extension of elbow, flexion and extension of knees, flexion and extension of neck. So there itself you got three examples. So not just sagittal plane, any plane, if similar questions are coming, you can just try to recollect uh, more than one movements occurring in that particular plane, or that plane as reference. In that way, you can think in reverse order and find the answer. So here the answer is flexion. Next question. The coronal or the frontal plane divides the body into what parts? Left and right, medial and lateral, anterior and posterior, superior and inferior. How will the coronal plane divide the body into? Is it left and right parts, medial and lateral parts, anterior and posterior parts, superior and inferior parts? Answer is C, that is anterior and posterior. That is front and back. This word here gives it away. So front and back is the answer for anterior and posterior. Next question. Shoulder abduction occurs mainly in the sagittal plane, transverse plane, coronal plane, oblique plane. So, in which plane does shoulder abduction occurs? Simple question. Answer is option C, that is coronal plane. So, suppose this is the middle line of the body. Sorry. This is the middle line of the body. Then this is two limbs. Then abduction. Abduction is, suppose, let's say this is the hand and this is the shoulder joint. Abduction is the motion of moving hands away from the body, like abduct itself, taking away from the body or taking away something. The word abduction means taking away. So, like that, taking away hand, taking hand away from the body. That's the motion. It is confined to a plane that is parallel to the body or parallel to the front of the body. That is the coronal plane or the frontal plane. Next question. Movements in coronal plane occurs about which axis? So you can think similar to what we discussed for sagittal plane. So if some movement is happening in coronal plane, which axis will be the reference? Options are vertical axis, option B longitudinal axis, option C medial lateral axis, option D anterior posterior axis. Yes, so first you have to recollect which is the coronal plane. So coronal plane is the frontal plane, plane facing the body. And so suppose if I'm writing the directions, this is a superior, inferior, right, left, posterior, anterior. So the coronal plane consists of superior, inferior, and right to left. this plane, this axis is will be lying on coronal plane, and the axis perpendicular to the coronal plane will be anterior posterior axis. Next question, the transverse plane divides the body into left and right, anterior and posterior, superior and inferior, proximal and distal. So try to recollect what's the transverse plane and how the transverse plane will split the body. Yes, the transverse plane. Traverse or transverse simply meaning cross section. The most of the transverse planes are used for, but perpendicular planes are called transverse planes or cutting perpendicular to the axis kind of planes. So we have a medial axis or uh, craniocaudal axis. So that plane perpendicular to that axis is called transverse plane, or which is, this is our coronal plane. So plane that is cutting perpendicular to the coronal plane is called transverse plane, and transverse plane will split the body into superior and inferior, or top and bottom. Our answer is option C. Next question, which movement occurs in transverse plane? Which among the following movement occurs in transverse plane? Options are flexion, extension, abduction, internal rotation. Try to recollect which are the motions happening in transverse plane. Yes, uh, if you remember the first question itself about the atlanto-occipital joint, those kind of motions are rotations. So the rotations happen with respect to transverse plane. The answer is option C, that is internal rotation occur with respect to or occur in transverse plane. Next question. Movements in transverse plane occur about which of the following axis? Options are mediolateral axis, anterior posterior axis, vertical axis, oblique axis. Yes, optional. So here there is no cranial caudal word. So here another word is there, vertical is there, also longitudinal axis is there. So option is vertical axis. So movements, we have already discussed what kind of movements are happening in transverse plane or rotations, and rotations, internal rotations are happening about vertical axis or craniocaudal axis. Next question. A muscle fiber is best described as a bundle of muscles, a single muscle cell, a group of myofibrils, a connective tissue layer. Which is the best description of a muscle, the word muscle fiber? A bundle of muscles, single muscle cell, group of myofibrils, a connective tissue layer. Okay, our answer is a muscle fiber is best described as a single muscle cell, option B. Whereas a group of myofibrils are known as, what is known as sarcomere. Next question. A muscle fascicle consists of a single myofilament, multiple myofibrils, a bundle of muscle fibers, a group of sarcomeres. So, what's the constitution of a muscle fascicle? Yes, option C, that is a bundle of muscle fibers. A muscle fascicle is, muscle fascicle consists of a bundle of muscle fibers. That is option C. Next question. The connective tissue that surrounds a muscle fascicle is called. So normally the bundle of uh, muscle fibers are uh, surrounded by one particular tissue, connective tissue, and which is repeated. So what is the particular name for that connective tissue? that surrounds a muscle fascicle. Is it epimysium, endomysium, perimysium, or sarcolemma? Yes, the answer is option C, perimysium. The connective tissue that surrounds a muscle fascicle is called perimysium. If you see here, so this is particular muscle fiber in the middle, and a bunch of muscle fibers are known as a fascicle, muscle fascicle, and these muscle fascicles are covered by, you can see here, it's perimysium. Okay, next question. This we have already discussed, the pennation angle. Pennation angle is the angle between muscle fibers and tendon. Moving on to next question. Increasing pennation angle generally allows a muscle to do which of the following? Options are increase contraction velocity, increase force production, reduce physiological cross-sectional area, reduce force output. So, increase in pennation angle generally allows a muscle to do which of the following? Increasing pennation angle generally allows a muscle to do which among the following? So what is the pennation angle? Pennation angle is the angle between muscle fiber and tendon. If you remember, there was one more option in the previous question. Not just previous question, before that. What's the role of pennation angle? There it was two things were there. Pennation angle is the angle between muscle and tendon, also the direction of force. So here you can just eliminate two options. You can only think of what is sorry, the ones with force. That is, there are two options with increase in force production and reduce force output. So how does the increase in pennation angle affect force production? Whether it will reduce or decrease? Yes, option B, that is increase in pennation angle. That is, if this is one particular muscle fiber, so the uh, increase in pennation angle will help in increase in force production. That happens when the eccentric loading happening. The answer is option B, increase force production. Next question. Which type of muscle architectures has fibers running parallel to the line of pull? So when there is a tension or when there is a pull, so Which type of the muscle architectures has muscle fibers running parallel to the line of pull? Options are bipennate, multipennate, unipennate, and fusiform. Option is option D, fusiform. So these are the skeletal muscle arrangement in the bodies. Main arrangements are fusiform, pennate. There are three subsections for pennate: unipennate, bipennate, and multipennate. Then parallel, circular, and convergent. So we had in the option we have fusiform and three different options of pennate. So this one, this bicep brachii is a fusiform where suppose this is the direction of pull, then the muscles will be arranged in this manner. It's like fused version. So such uh, arrangement is called fusiform arrangement. Okay, that's all for today. Thank you for joining.